All right, next on the list for the enteric organisms is Yersinia. Now, Yersinia, for a long time, kind of went low yield for step one, and now it's kind of making a little bit of a comeback because of its potential as a biowarfare agent. All right, so the two species we're going to talk about are Yersinia pestis, which of course causes bubonic plague or Black Death, and then Yersinia enterocolitica. The features here are similar to what we talked about with Shigella, okay, in that they're H2S negative and they're non-modal. These are facultative intracellular pathogens, okay? So again, you're going to get this kind of granulomatous response. They're coagulase positive, and the reason I bring that up is because the coagulase is actually important in the transmission of the disease going from the insect vector, which is the flea, to the human. And I'll talk about that in just a minute. Now, pestis is a classic zoonosis, okay? Like we talked about with, what did we talk about already that was a zoonotic disease? We talked about Francisella and we talked about Brucella that were zoonotic diseases. This one's no different, where the reservoir are typically in squirrels, prairie dogs are big, and the vector of transmission in this case is the flea. Remember, vectors are very, very important for step one questions. All right. Also, what I want to point out is in this list of the reservoir, it mentions the U.S. desert Southwest. All right. There is an area of the U.S. that we call the desert Southwest that almost has its own little microcosm of microbiological disease, okay? And Yersinia pestis is one. Hopefully you're starting to think about some others, okay? The fungal infection that we're going to see from that area is coccidioides, all right? And the viral infection we're going to see from that area is hantavirus, right? So there are three things that are really predominant in that area of the country. So if they're mentioning that in the vignette, you've got a patient from Arizona, Nevada, something like that, and they start presenting with the symptoms of, let's say, pestis or coccidioides, that's going to be a big clue for you, okay? And again, it's a potential biowarfare agent because, especially in the aerosolized form, it can be extremely virulent and highly fatal. Now, transmission is from the bite of a flea, although once it's in the respiratory tract, it can be human to human. And in that case, it's very, very contagious. Now, I told you I would mention a little bit about the coagulase. And what happens with the coagulase is that once the flea bites, let's say, the prairie dog, okay, bites the prairie dog is infected with Yersinia pestis. The organisms get into the gut of the flea, and the coagulase that's made by Yersinia pestis causes the gut of the flea to kind of coagulate. So now, when the flea goes to bite another animal or another human, it regurgitates that gut contents into the next victim, and that's what allows it to be transmissible because it's clotted in the gut. So it regurgitates the gut contents of the flea. We're clearly talking about very small stuff here, okay? But it's going to get injected right into the next animal or a human. So that's where coagulase is important for pestis. Now, as far as the other virulence factors, there is an envelope antigen called the F1 that inhibits phagocytosis. But again, as far as virulence factors here, probably the coagulase is going to be relatively important. And this is one of the organisms that also has one of the type 3 secretion systems that we mentioned earlier. Now, the two different forms of plague, we have bubonic plague, which comes from the flea bite, okay? And this is called Black Death, okay? So back in the day, this was really, really a scary disease, okay? So you would get bitten by the flea, you would get the symptoms you see here, you get a fever, and you get these very, very swollen lymph nodes, usually in the axilla or the groin area, and you would get conjunctivitis. And if that went untreated, you started to get disseminated intravascular coagulation. And what went along with that was that the digits and all of the other areas that were affected by the DIC turned black. So that's where it got its name, Black Death. Now, this can lead to sepsis and death if it's untreated. A little bit easier to treat bubonic plague than pneumonic plague. Pneumonic plague is what we worry about as far as a biological warfare agent. So in pneumonic plague, if you're talking about aerosolizing Yersinia pestis over a large city, okay, what's going to happen is people are going to inhale that, they're going to get pneumonia that's, number one, highly contagious and extremely fatal. So it's not that we're worried about people dumping out a box of infected fleas and we're going to have to run from the fleas. It makes like a really bad B movie. But it's the pneumonic plague that we're worrying about for biological warfare. Now, diagnosis. Want to mention the diagnosis here because it can cause sepsis. You can do a blood culture. You might actually do a lymph node biopsy. And what you're going to see for the organism is something called bipolar staining. So the organism itself in the stain is going to look like a safety pin. So imagine that you have a rod, all right, the gram-negative rod, and on each end stains, but the middle doesn't. So it is very close to resembling a safety pin, if you know what the safety pins look like. So it's also called safety pin staining. That might be a helpful buzzword. They say they did a stain and it looked like a safety pin, or if it was bipolar, that's very indicative of Yersinia pestis. Now, the treatment for Yersinia is aminoglycosides. You also actually have to quarantine the patient, especially with pneumonic plague. And prevention really speaks to control of the insect vector and the animals. We do have a vaccine available for Yersinia pestis. Again, we would say given to high-risk populations, which, as you can see on the slide, in this case is predominantly the military. Now, the other species of Yersinia is Yersinia enterocolitica. A couple of interesting features about Yersinia. Number one is that it can grow at cooler temperatures. So think about the other organism we talked about that can grow at colder temperatures. That was Listeria monocytogenes. Okay, so now we're going to add one more to the list. I promise no more. One more to the list. So this one can grow in the cold. It is actually motile in the cold and non-motile at body temp. Right, so it changes its motility based on the temperature. This is also a classic zoonotic disease. Typically, you're going to see this, if we're talking about the U.S., we're talking about the northern climates, and Michigan tends to be one of the high incidence states for enterocolitica. If we're talking about worldwide, Scandinavia also has a high incidence of Yersinia enterocolitica. And the transmission is typically from unpasteurized or poorly pasteurized milk and also infected pork. Now, virulence, enterotoxin, endotoxin, and the fact that it multiplies in the cold, okay? That is definitely going to play a part in the transmission. Now, the disease is different depending on the age group that acquires the infection. And this is one of the things that, and what they like to ask typically about, is that it causes pseudoappendicitis. So in children and young adults, they'll get something that mimics appendicitis, okay? They'll come in with this intense pain. They'll go into the ER. They'll say, whoa, we think you have appendicitis. Take them into surgery. Oops, the appendix isn't swollen. So that is a very good kind of clue that you might have Yersinia enterocolitica. Couple of other diseases that can give you something similar to appendicitis that we'll talk about a little bit later on. So that's probably the main thing they like to ask about, because that's kind of a little bit different from a lot of the other organisms we talked about. In very young children, you're going to get the bloody diarrhea that we've mentioned several times already with Campylobacter and with Shigella. And adults will get enterocolitis, but they can also get kind of a post-infective reactive arthritis. All right, so different depending on the age group, with probably the pseudoappendicitis being the most board relevant. Now, how are we going to diagnose it? We're going to try to culture it, and we can enrich or select for the organism based on the fact that it grows in the cold. Treatment, as we've mentioned, for all of the other enteric gastroenteritis causing organisms, usually self-limiting, all right? If you have someone that's having a very severe infection, you can treat with a fluoroquinolone or one of the newer generation cephalosporins.